Exercise is meant to be simple. It is not meant to be difficult or complex. Joseph Pilates said that muscle fatigue is muscle poison, or in other words, you don't need to hurt yourself to be healthy. The Pilates technique is an efficient and effective means of exercise for people of all ages. 3 actions need to be emphasized. First, breathe deeply. Second, always relax the neck and shoulders. Third, initiate each movement from the powerhouse. That means if you view your body like a car, the ignition has to be at the belly. So start each exercise with a contraction at the belly. Hi, my name is Jai Whiskey, and I'm a licensed physical therapist, and I have been certified as an athletic trainer, and I am a Pilates instructor. I've worked with world champion kickboxers, national record-holding weightlifters, Olympians, and professionals. And my best patient was a 75-year-old man who never practiced more than the exercises you're about to see on this tape. This gentleman had been bedbound for over 30 days with a serious low back injury from a slip and fall. He had discs that were protruding at L5 and S1. His bones were significantly out of alignment in this area, and he had a bone spur. In my profession, that usually indicates surgery or a life focused on pain management. Instead, he practiced no more than these essentials, and in less than 6 months, the bone spur resorbed, the protruding discs resorbed, and his bones not only realigned, but aligned to better than prior to injury. Consequently, I've become a practitioner of especially this 15-minute essential Pilates program. Why not give it a try? Let's get started. Breathing is the single most important and fundamental Pilates exercise. To begin, take 2 big belly breaths. Release your lower stomach as if you were a newborn baby or any animal in nature. Next, take 2 big chest breaths as if you were Superman or Superwoman. Breathe big into the chest all the way around, especially through the back. Next, take 2 big relaxing breaths into your shoulder and neck area. Allow the space between your shoulder blades to increase and allow all your neck muscles to relax. Even your jaw goes slack at this point. To prepare for Pilates, you want to practice now the classic Pilates breathing style, which is keep your lower belly flat, somewhat contracted, while breathing deep into the posterior lateral ribs. That means breathe into your back, especially the back and lower portions near your chest. Do this 5 times in preparation, and be prepared to do each of the following exercises 5 times each. There's a reason Joseph Pilates put breathing as his first and foremost exercise. It is by far the most important thing you can teach yourself. So please do not neglect this particular portion of the program. The next and second most fundamental exercise is called imprinting. Use your imagination as if you were a kid. Imagine that you can breathe into the bones of your back. Relax and breathe into your tailbone, increasing its size and weight by 50 times more than what it was before you started. Relax and breathe in between the spaces of each individual backbone through your middle back, and especially increase the space between your shoulder blades. Allow your neck and shoulders to relax and all bones sink into the mat as if it was a footprint sinking into wet sand. Even allow your neck and jaw to go slack, the small muscles around your eyes and in your forehead. Even your hands, feet, calves, forearms, thighs, arms, waist, and torso relaxes. The most powerful low back exercise is the pelvic tilt. Remember to initiate from your belly muscles, and if you can, try to inhale as your back arches and there's more room for belly air, and exhale as you flatten, which increases the strength of the movement. Stay within your pain-free range. Next is bent knee hip lift. Bend one knee and keep the other leg straight. The side of your body that has a bent knee, that side hip will lift and roll in a relaxing fashion. Breathe deeply and uncork and unwind your back at least 5 times each side. This is a favorite of all my low back pain patients, and if it feels good, feel free to do more than the 5 that are requested. Now, with both knees bent, perform basically the same motion. You will endeavor to keep both knees as still and as skyward as comfortable, and rock your pelvis back and forth as if it was a bowl full of water sloshing side to side. My patients and athletes have affectionately nicknamed this exercise the hula bowl. And in this exercise, you will try to roll around the outer rim of your pelvis. And if you can, continue to breathe deeply as you arch and exhale as you flatten. Do at least 5 each direction. Stay within your pain-free range. Keep your neck and shoulders relaxed. Initiate from the belly and breathe deeply. This is a good opportunity to practice squeezing deeply in the powerhouse. If you cough, or laugh or sneeze or even kiap martial arts style, you'll exercise the transverse abdominis, and beneath this is the psoas that's attached to the hip. All of these next exercises key on these muscles. First is knee sway. Relax and let both knees drop to the side as you stretch your low back. Then, with a forceful cough or a deep contraction at your belly, or both, pull through your psoas, your hips to the center, and then let them relax to the side. Focus on quality and keep your neck and shoulders relaxed. Next in this series of 5 all-important powerhouse exercises is small steps. Pull deep from your belly, lifting your knee to 90 degrees, and then placing it back where you started. Focus on squeezing deep, even include a Kegel, which is a contraction of the pelvic floor, if you can. Next is knee circles. Place one hand on your knee and keep the other hand at your lower belly and continue to contract from deep in the pelvic floor and lower abdominal area. Perform small circles, meaning only as far as your arm and hand allow, and do 5 each direction. The idea with this series is to relax all the muscles except for those in the lower belly, the psoas, and the pelvic floor. Everything else should relax as you breathe deeply. The last 2 of this series of 5 exercises focusing on the hip and belly musculature is a heel slide with your back in a normal, natural curve. Check to make sure this is so, and then slide one heel out, inhaling and relaxing. On the exhale, draw in deep through the belly muscles and even the Kegel pelvic floor muscles as you slide your heel up and as close to the buttocks area as comfortable. The last of this grouping of 5 is with a flat back, and it's the same as the last exercise. Slide your heel out, relax, breathe in, become 7 foot tall, and on the exhale, use those deep muscles to draw your heel in towards your backside. If you're not sure in any of these exercises, cough or laugh or pretend to sneeze, and you'll feel the muscles that should be invoked for these 5 exercises. The goal of this next exercise is to feel completely your tailbone, otherwise known as your sacrum. Curl and feel the back of it, and then relax back to a normal position. Do this at least 5 times in preparation for the next 2 exercises. The goal of the articulating bridge is to initiate the movement at the powerhouse or the belly, feeling the tailbone curl, and then roll 1 vertebra at a time until you're resting up on your lower shoulder blades. At this point, roll down your back 1 vertebra at a time, as if inspecting and relaxing each vertebra like it was a pearl on a strand of pearls. Many of my patients find this the most relaxing and relieving exercise that they perform in this beginning series. So allow yourself the time to feel each of your backbones. Anyone in any of the healthcare professions will tell you all health resides in the spine. Learn to feel your spine. With this, the articulating bridge. Next is a normal bridge. Many of you have seen this. The only alterations Pilates made was to have you emphasize on starting at the powerhouse in the belly and try and feel the lift through the hamstrings and the inner thigh and less through the gluteal muscles. Cervical nods is the same as performing a pelvic tilt, but at the opposite end of the spine. Release the base of the skull at cervical vertebra 1, and if you like, use your hands to help relax at this all-important area while performing what is known as the universal yes movement. Nose circles is similar to the hula bowl. Release the base of your skull again. Use very few, if any, of the neck muscles while rolling in a circular motion through cervical vertebra 1 and 2 at the top of the neck. Feel free to use your hands to help. The idea is to learn to relax your neck while moving and loosening at the base of the skull. The next exercise is known as angel arms. Feel free to pretend you're an angel. Breathe in as you lift up and out with your arms. Exhale as your hands come down, reaching low and well past your toes, at least in your mind. Keep your shoulder blades low throughout this movement. Keep the neck long and relaxed, and still initiate from the belly. Next is rotating arms. Each of the arms goes in opposite directions. And the idea is, how much can you move your scapula, your shoulder blade, up and away while the other squeezes down and in? This is a great one for loosening the neck and allowing for deeper chest breathing. Next is known as torso twist. The idea again is to initiate from the belly, then use your hands for support, moving your neck and head last. Especially for those that have neck injuries, the idea is to always have the neck supported. This emphasizes that concept by moving from your center and keeping the center underneath you, following and finishing with the head in a cradled and stable spine. The key feature of prone hip extension is to lift the leg without using the gluteals. Feel free to keep your hands on your gluteals and initiate the movement from the belly and the hamstrings, lifting the leg without tightening the backside. For those of you that have taken up running as a sport, this can be difficult and require practice. It's well worth it, as it lessens the pressure on your low back. Similarly, flight is initiated from the belly and learning to lift through the upper back without using your neck muscles. Keep your neck long and relaxed. Pull in the shoulders. Inhale on the way up. And, as always, stay within your own pain-free range. Next in this hands and knees position is the cat series. This is arch and then sway back. Learn to arch your back as you exhale, pulling the shoulder blades apart, reaching the head toward the tail. Then, on the alternate movement, reach head and tail toward the sky as shoulder blades come together. Endeavor to initiate from the belly. Breathe deeply. And keep your neck and shoulders relaxed. The 3 essentials of the Pilates technique. Next is side bend. Try and reach your head toward your tail in a flat side bend, no arching in the spine. You'll make a letter C and a reverse letter C if someone were looking at you from above. Exhale on the movement, inhale to the center. The last exercise is excellent for scapular mobilization on the spine. Keep the spine flat while raising and lowering the body on mobile shoulder blades. Shoulder blades tap, then shoulder blades pull apart. Inhale on tap, exhale on pull apart. Joseph Pilates' ideas were to not spend your entire life exercising. This program need only take 15 minutes, and it should augment the rest of your life. Go out and walk, dance, swim, or whatever you choose to do to play, knowing that you're moving in a more natural and efficient method. The Pilates method. Initiating from the belly, breathing deep, and relaxing your neck and shoulders. Thank you, and good luck.
Back in July.